This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today. Welcome to the Global Men's Wellness. I'm Dr. Judson Brandeis, and I'm so glad you're here. There are few experiences that can bring a grown man to his knees faster than the pain of a kidney stone. It's a searing, debilitating pain that often comes out of nowhere and is frequently compared to childbirth. It's an experience you never forget, and one you desperately want to end as quickly as possible. While many small stones can be managed with hydration and pain control, a significant number require intervention. In the past, this often meant major open surgery. Today, we have an arsenal of minimally invasive tools and techniques that allow us to tailor the treatment directly to the patient and their specific stone. The modern management of kidney stones is a sophisticated, evidence-based field focused on one thing: providing the most effective relief with the least amount of morbidity. Today, we're going to explore this clinical framework for the surgical management of stones so you can understand the options and partner with your doctor to make the best possible choice. So, what exactly is happening when a kidney stone causes so much trouble? Stones are hard deposits made of minerals and salts that form inside the kidneys. They can be as small as a grain of sand, or, in the case of a staghorn calculus, as large as the entire inner contour of the kidney. The problem usually begins when a stone moves out of the kidney and into the ureter, the narrow tube that carries urine to the bladder. This is the body's plumbing system. When the stone creates a blockage, urine backs up, causing immense pressure and swelling in the kidney, which in turn triggers intense pain. The goal of surgical management is to remove that stone or break it into pieces small enough to pass, relieving the obstruction and preventing long-term kidney damage. The mechanism for choosing the right treatment is a highly personalized process, guided by the stone's size, its location in the urinary tract, and its density. The first step is always high-quality imaging. A non-contrast CT scan is the gold standard. It gives us a precise roadmap, showing us exactly where the stone is, how large it is, and can even give us clues about its composition. This information allows us to determine which of our surgical tools is best suited for the job. For a small stone in the lower part of the ureter, the mechanism of action might be medical, using a medication to relax the ureter and help it pass. For a large, dense stone in the kidney, the mechanism will be much more direct and invasive. The modern approach to stone surgery is built on a mountain of evidence consolidated in the American Urological Association and Endourological Society's comprehensive guideline. This framework is based on a systematic review of nearly 2,000 peer-reviewed studies, ensuring that the recommendations are not based on opinion, but on data. For example, for patients with uncomplicated ureteral stones that are 10 millimeters or smaller, the guideline gives a strong recommendation to first offer a trial of observation, as many will pass on their own. For those in the distal ureter, it also strongly recommends medical expulsive therapy, or MET, with alpha blockers, a class of medication proven to increase the chances of spontaneous passage. Despite the high prevalence of stone disease, many people are unaware of the full spectrum of treatment options available. There's a common misconception that all stones are treated with shockwave lithotripsy, the non-invasive blasting procedure. While SWL is an important tool, it's not always the most effective one. Many patients also don't realize that for certain stones, a minimally invasive endoscopic procedure might offer a much higher chance of being stone-free after a single treatment. Another area of confusion is ureteral stenting. Many assume a stent is an unavoidable part of any stone procedure, but the guideline makes it clear that routine stenting should be avoided in many common scenarios to spare patients from significant discomfort. The patient experience varies dramatically depending on the chosen procedure. For a small stone, you may be offered medical expulsive therapy, where you go home with pain medication and an alpha blocker like tamsulosin and try to pass the stone naturally over a few weeks. If intervention is needed, one option is shockwave lithotripsy, or SWL. This is a non-invasive outpatient procedure where you lie on a special table while focused sound waves are used to break the stone into smaller, passable fragments. Another common option is ureteroscopy, or URS. This is a minimally invasive surgery performed under anesthesia, where a tiny flexible scope is passed through the urethra and up the ureter to the stone. A laser is then used to break the stone apart, and the pieces can be removed with a small basket. For very large kidney stones, the most effective option is percutaneous nephrolithotomy, or PCNL. This is a more invasive procedure that requires a small incision in the back to create a direct tunnel into the kidney, allowing a surgeon to break up and remove large amounts of stone material. This is where personalized urologic care truly shines. The guideline provides a clear, risk-stratified framework based on the patient's specific situation. For a symptomatic non-lower pole kidney stone that is 20 millimeters or less, SWL or URS are both excellent first-line options. However, for a stone burden greater than 20 millimeters, the guideline strongly recommends PCNL as first-line therapy and advises against using SWL. Location is also critical. For a stone larger than 10 millimeters in the lower pole of the kidney, the guideline recommends against SWL as a first-line therapy because the anatomy makes it very difficult for fragments to pass. In that case, PCNL has a higher stone-free rate, and this information is shared with the patient to help them make a choice that aligns with their goals. This personalized approach is highly effective. Ureteroscopy, for instance, has a greater stone-free rate in a single procedure than SWL for most ureteral stones. PCNL has the highest stone-free rate for large, complex stones. And medical expulsive therapy, with alpha blockers, significantly improves the passage rate of small distal ureteral stones, from about 54% with observation alone to over 77%. By selecting the right procedure for the right stone, we can maximize success and minimize the need for repeat treatments. The ultimate goal is to get the patient stone-free as efficiently and safely as possible. The future of stone surgery is focused on making our tools even more effective and less invasive. This includes the development of new laser technologies that can dust stones into a fine powder that passes easily, eliminating the need to remove fragments with a basket. There's also a tremendous amount of research going into creating better ureteral stents, perhaps made of biodegradable materials that dissolve on their own, or designed in a way that dramatically reduces the pain and discomfort they can cause. And as our imaging technology improves, we may soon be able to better predict a stone's composition and fragility from a CT scan, allowing us to choose the most effective treatment modality from the very beginning. My work as a urologist is often about helping people through some of the most uncomfortable and painful experiences of their lives. Relieving the acute, debilitating pain of a kidney stone and providing a path back to a normal, productive life is incredibly rewarding. The better way forward in stone management is not about having one favorite procedure. It's about mastering a full range of techniques and applying them judiciously. It's about using the best available evidence to have a frank, shared decision-making conversation with each patient about their options, their chances of success, and the potential risks, so that together we can choose the path that will get them back on their feet as quickly and safely as possible. Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.